Hi, today we are going to talk about how to use the Intimate Rose pelvic wand to address tailbone pain. So when we're talking about tailbone pain, it can be associated with a lot of different types of muscular coordination issues, strength issues, restriction issues. But we are going to talk about how to address it when it's due to overactivity of the pelvic floor muscles as they attach to the tailbone here. So I'm going to give you a couple of different views. So this is the external view here, the pelvic floor muscles being everything you see in red coming off of the pubic bone, coming wide, coming in, inserting onto the perineal body, wrapping around the anus and the rectum, and then attaching back onto the tailbone there. So there's a couple of different groups of muscles in there, but they do all attach to each other. So when we are talking about tailbone pain, it can be due to a fall where you fell down on your bottom and it pushed the tailbone upwards. It can be due to childbirth, where as the baby was exiting the vaginal canal, it was compressed into extension. And it can also be from chronic clenching of the muscles around that tailbone there. So in females, you can approach it vaginally or rectally, and in males, your only option is rectally, sorry. But the wand was designed to be able to use either end. When we are talking specifically about tailbone pain, I highly recommend that for most people, the easiest end to use is going to be this long, thin one here. And that is both for a vaginal or a rectal approach. So first, talk about rectal approach, because that is the easiest one to reach around the tailbone, because it is going to put you in very close proximity. That's not always a very pleasant experience. I've been there. I fell on my bottom and I had to get that treated, and I know that it can be really uncomfortable, but if you're using really good breathing mechanics, if your therapist is working on you in that area, or if you're working on yourself, just be sure to be breathing and using music and position changes as needed to help get you through that. The other thing is there's a lot of different ways to wrap a present. So if you are female or if you have a vagina, you can be using a vaginal entry approach to reach some of that tissue, and I'll show you how in just a minute. So here's the back side of you. I recommend laying on your side if you're doing rectal work here. And so essentially laying on your side with the top leg on a pillow, and then you can put a generous amount of lubricant, water-based lubricant, on the end of the Intimate Rose wand here, and just bring it to the rectal opening. From here, I recommend you take a few deep breaths in, and you can either insert on an inhale or on an exhale, either way, but I do recommend bearing down just a slight bit, not holding your breath to bear down, but just bearing down slightly as if you were going to pass gas or have a bowel movement. What that does is it drops the pelvic floor, it opens that area, and that way you can just slightly roll the wand in there, into the sphincter and up into the muscle area. Get a sense of how that feels, take a few more deep breaths, and then I'm going to show you the inside here. And then from there, it's just about a half an inch to an inch up to reach some of the tissue around the tailbone. So from there, if this is your tailbone here, and the wand has gone in, and say we're right about half an inch to an inch away, you're going to dive off upwards or downwards, feeling for areas of tenderness. We're never pushing any harder than we would use to check a tomato for ripeness, and allow the wand to just make contact with that tissue. From there, you can do a gentle stroking maneuver to help relieve some tension in through the area, or you can have it sit there for just a moment to allow for some tender point release if you recognize that there's a knot there, and then move it and then bring it so you would angle it down and check the other side. So again, you're laying on your side, so you would be going up towards the ceiling or down towards the floor. This can take a couple of sessions, and you can even be stroking it downwards at an angle here just to get a little bit of tender point release. There's no need to go and push on the tailbone itself. That's a very sensitive structure, even if you don't have an injury to that area. There's a lot of nerves, there's a lot of vasculature in the area, it's very sensitive. So there's no need during this kind of treatment to be making contact with it. As a physical therapist, pelvic PTs may mobilize on that bone there internally, but that's a very specific technique and not one that we are going to do with the wand, especially for a self-treatment kind of approach. Switching gears, talking about using the wand to go vaginally to address tailbone pain. So here we have the inside of the pelvic bowl. So if you are laying down on your back, again, I do recommend using this long flat end. Plenty of lubricant, inserting into the vaginal canal. So in order to get it to come in, we're gonna be entering it in and then dropping it down like this. So if this is the vaginal canal, it's coming in and you're dropping it down at an angle like this, down towards the ground if you're laying on your back. And again, imagining if this is the tailbone and we're coming in through the vagina, we wanna drop off to the right and the left. Different from when you were laying on your side and we were going up towards the ceiling or down towards the ground. So dropping it off to the right and to the left, and then gently releasing the muscles that fan off the side there. So you see here is the tailbone. The muscles come off through the side. So if you're coming in through the vagina, you can just be gently angling down like this. And if you find a tender point, never pushing harder than you would use to check a tomato for ripeness, but you can hold a little pressure there. You can move your leg. That will help contract the muscles around the hip. That can help produce a little fascial glide around the pelvic floor that can be really beneficial as well. And just using a couple of different strokes for a few minutes to do some gentle release. Always take a day off. If you're sore, you can take a hot bath, go for a walk, go for a run, do pelvic floor stretches. We do have a great guide to pelvic floor release on the website that I wrote with some other videos on it that will help show different stretches that are beneficial. And as always, if you have any other questions, don't hesitate to email us at support@intimaterose.com.